Do you need a cancer policy with your Medicare coverage? Hi, my name is Robert Bache. I own Senior Healthcare Direct, MedicareBob's office, and my agents and I, we assist people with Medicare nationwide. In this video, I'm going to talk about cancer policy or cancer coverage insurance that works for you and Medicare. So a question I'm getting a lot on our Facebook and YouTube page right now is, Bob, what is a cancer policy and do I need it with my Medicare coverage? So let's first talk about how a cancer policy works. You will pay a company anywhere from $20 a month and higher, and then for a lump sum money if you were to get cancer. So let's say you're paying $20 a month, and if you were to get cancer, your policy is $15,000. So if you're paying that premium per month, and then God forbid you get diagnosed with cancer, that carrier that your cancer policy is with is going to mail you a lump sum check of that $15,000. And you can use that $15,000 however you want. If you want to use it to pay your medical bills, you can. If you want to use it for travel expenses or special dietary needs, you can use that $15,000 however you want to. That is your money once you get the payment from your policy. So now let's talk about if you have Medicare, if you need a cancer policy. Well, if you follow me on YouTube and Facebook, you know that all the types of Medicare stuff you see online fits into one of two categories or two types of plans. You can have a Medicare supplement or a Medicare Advantage plan. So let's first talk about if you have a Medicare supplement plan, do you need a cancer policy? Well, in order to establish that, let's talk about how a supplement plan would cover you if you were to get cancer. Well, if you were to get cancer, your Medicare supplement plan and Medicare will pay for your chemotherapy or any outpatient procedures or anything that's administered by a doctor. Medicare will pay 80% and your supplement pay 20%. So if you have a Plan F or a Plan G or a Plan N supplement, you're not really going to have any big bills if you were to get cancer because it should cover you on the medical side. However, Part D prescription drugs that you might need for your cancer treatments, those can be really expensive under Part D. So if you have a supplement and a separate Part D, you might have higher cost cancer prescriptions. Also, if you have to travel to go get your cancer treatment, you might have some traveling expenses. And you also might have some non-medical related expenses with cancer, like a wig or special dietary needs and travel expenses, as I mentioned. So if you have a supplement plan and a standalone drug plan, you don't need a cancer policy because, again, the supplement's going to pay the bulk of your treatments that you get from a doctor's office, but a cancer policy might be nice to cover the non-medical stuff that I talked about, as well as your increase in drug costs if you have any more and more, we're seeing more and more chemo drugs that you can take from the comfort of your home. The problem is they're more expensive that way through your Part D, but if you have a cancer policy, you can use those funds to pay for those expensive drugs. So if you have a supplement, you don't necessarily need it. It's going to cover, the supplement and your Medicare is going to cover all your treatments that's inside of a doctor's office, but it might be nice to get a check for $10,000, $15,000, or $20,000 to help you out with the drug costs and or any non-medical related fees that come along with getting treated for cancer. So now let's talk about Medicare Advantage. Well, the two biggest holes in any Medicare Advantage plan is usually hospital and cancer. Normally, if you have a Medicare Advantage plan, you're going to pay anywhere from $100 to $400 per day each day you're there, days 1 through 7. But when it comes to cancer, especially, that's the biggest hole in almost just about every Medicare Advantage plan nationwide. If you think you're covered and you have an Advantage plan, go look at your summary of benefits. There's a 90% chance that when you look at that and how it covers outpatient chemotherapy and outpatient cancer treatments, you are going to have to pay 20%. That's right. If you have a Medicare Advantage plan, you are going to have to pay 20% for your cancer treatments that are done in a doctor's office, up to your max out of pocket, which nationwide right now is $6,700. And remember that $6,700 resets every January 1st. So if you, God forbid, get cancer, say in September, and you have a Medicare Advantage plan, it's likely that you're not only going to meet that $6,700 through the end of the year, but then you're going to have to start paying it again come January to finish your treatments. So if you have a Medicare Advantage plan, I would highly recommend a cancer policy, not only for those outpatient treatments that you're getting in the doctor's office that you have to pay 20% of, but just how with the supplement, you're going to have higher costs in the drug plans. Same thing with your Advantage plan. You're going to have higher costs on drugs and medications if they do give you some cancer meds to take at home. So if you have a Medicare Advantage plan, I strongly recommend getting a cancer policy because it really is the biggest hole in any Advantage. So if you have a supplement plan, you know, it's really your call. I don't know if you need a cancer policy. I guess if you look at your family history and if cancer is prevalent, then, you know, if it's in your budget, it's not a bad thing. It is going to help you out with the non-medical treatments or non-medical costs that go along with getting cancer treatment, as well as your increase in drug costs. If you have an Advantage plan, I would say yes. We recommend attaching a cancer and actually a hospital plan as well with all of our Advantage plan customers because those are the two biggest holes in Medicare Advantage, and cancer is the biggest of all of it. So MedicareBob's recommendation, if you have a supplement, totally your call. Not a bad thing to have a cancer policy with it, but it's going to help out with some stuff. But if you have a Medicare Advantage plan, I'd strongly, strongly recommend getting a cancer policy. So if you have any questions about Medicare, cancer policies, hospital plans, drug plans, dental, vision, hearing, anything with Medicare, I'll list our link on the description below. Our phone number is listed in the video, so feel free to give Senior Healthcare Direct, MedicareBob's office a call, and we'll get your Medicare done right.